Hello, dear YouTube audience. Thank you for clicking on this video. My name is Yolanda, and in this video, I'm going to give a talk about a clinical model to test the amount of PrEP drug in human blood. As many of you may get confused about the jargon, what is PrEP? PrEP is in short of pre-exposure prophylaxis, which is a preventive drug for the HIV virus. Up until 2019, people living with HIV has reached about 38 million globally, including 1.1 million cases in the US. People at high risk of getting infected by HIV through sex or injection are recommended by the World Health Organization to take this drug, and it reduces the risk by over 90%. Despite the increasing number of people receiving this preventive drug, there is a problem following the doctor's prescription. Whether patients know about it or not, PrEP is most effective when taken daily as prescribed, and it becomes less effective if the pattern is disrupted. Studies find out that roughly 30% of people who are prescribed PrEP drugs fail to maintain their daily consumption, and doctors have no way to know exactly how much their patients are taking. Currently, the primary way for doctors to know is by patient self-reporting, which is not necessarily reliable. Direct detection of the drug concentration in blood also turns out to be difficult because the drug itself decays pretty fast in human body and forms complex molecules. To solve this problem, we developed a clinical model that uses the functional nature of PrEP drugs to estimate its concentration in a sample. But before we talk about the model, we need to know a little bit more about how PrEP drugs work. HIV virus infect our body by attacking the T cell, which is a type of immune cell, the green one over here. After the virus gets to the target cell, the virus injects its RNA into the cell, and the RNA goes through a process called reverse transcription to form double-stranded DNA. The DNA would later invade into the cell nucleus and provide more virus growth. PrEP drugs works by interrupting this important reverse transcription process so that the viral RNA eventually dies without reproducing the virus. The main ingredient of the drug forms a molecule called tenofovir diphosphate in human cells, which we will refer to as the drug molecule later, for simplicity. When the viral RNA is reverse transcribing, a functional protein called reverse transcriptase picks up the nucleotides around to pair with the original code of RNA. Without the drug present, it behaves normally and creates a new complete strand of cDNA to continue the virus invasion. However, with the presence of the drug, the protein gets confused. Chances are that it will be fooled to pick up a drug molecule instead and put the drug on some specific site of the new strand. Once the drug is plugged onto the DNA by mistake, it acts like a stopper so that the transcription stops. The result of this process is an incomplete piece of cDNA that can't do anything harmful. This is basically how the drug works in our body to stop the spread of HIV virus. But how does this help us know the amount of drug in someone's blood? The length of the cDNA strand before it's cut halfway is the key. Although the incomplete DNA strands are no longer dangerous in terms of viral growth, clinical technology can still detect their presence. We design probes that are similar to alarms so that when a certain piece of the DNA strand is present, they glow and provide signals. If the DNA was cut before the detectable piece, then the signal won't show up in the result. The probability of seeing a positive signal in a single run depends on the number of RNA strands present, the number of spots where the drug can hop on, and the relative concentration of the drug. Based on this fact, we developed a probabilistic model. So now, using the model, we can get a unique probability of seeing the positive result for a certain amount of the drug if we either fix or measure the other factors. To be more specific, we have unknown tenofovir concentration in the patient's blood sample, but we also provide known numbers of viral RNA strand and binding sites for the drug. Mixing the two solutions together and going through the detection multiple times will give us different possible outcomes. Theoretically, if we repeat the run for many times, the proportion of positive signals will approach the actual probability of it showing up. Just like if we throw a coin for 1,000 times, the proportion of heads and tails that we get will be about 50-50. But since medical results are limited, we can't repeat the runs too many times as if we're throwing a coin, so the number of repeated runs will be controlled within 10 in practice. We can then use the results from those repeated runs to estimate the drug level in the patient's blood. Patients showing more positives on the left side means that there are more likely more complete strands of virus cDNA formed during the detection process, and thus the concentration of the drug is too low. Those patients are generally more likely to have not followed the doctor's instruction on taking PrEP drugs. But if, to the opposite, patients show more negatives in the test, we can infer that most of the strands were cut by the drug before it could replicate, which indicates that drug level in the blood is high enough. Using this test, doctors can spot the patients who are not following the instruction of taking drugs and then put extra care into educating and reminding them. Thank you for listening.